In earlier, we have a lot of malaria patients in our hospitals. There is a lot of patients will come rural sites. Some specific areas are in very high density of mosquitoes. On that areas, we will find lot of malaria patients. Then that patients always try to come to major hospitals to take treatment. There is a rural area, a lot of hospitals, but patient don't like to go to that rural areas. But if patient has a fever, but in rural area, doctors and staff always try to patient transfer to the major hospitals. Then in major hospital there is a good service in fever patients, because most probably thing is we always try to give malarial drugs for patients in sharp time. That is the very important thing, because that is the infected disease. No, then always we want to give some antibiotics for them. We want to give in every, if we are going to give 8 hourly, we want to give especially in 8 hours, right? And then we will do, we have done that. Then the other one is we always try to if we have a malaria patient in the ward, we will try to isolate them, because on hospital area also have mosquitoes. If they will transmit it to other patients, that one is the major problem. Then we always try to control mosquito levels in the hospitals in prevention programs. Then other thing is always we kept patient in the side of the in the wards, and we try to always use the mosquito nets for that patients. In a lot of patients, they have a lot of shivering on that time. They always try to, they can't tolerate their shivering and other things. Then on that time we will try to covering on that patients very hard clothes like that on that time. Then finally, if any patient will come to hospital have a fever, we always investigated for a malaria. That one is the good thing for, we will on that time we are hoping to eradicate that. That one is very important for us. After I think 4-5 years, and nowadays also, if we have a patient with fever, we try to, if we ask you have a shivering or something, then we suspect him for a malaria, we will always done investigations in the major hospitals. In the care, then most probably as a nurse, we will give health education for all the patients and the visitors. Then we want to stop that one, because as a nurse we are collecting all the details from the patients, and we have done lot of surveillance. In Sri Lanka there is a special campaign for eradicated that malaria. We send all the details from the patients to that special malaria campaign and epidemiology unit of Sri Lanka. The epidemiology unit is the major responsible person for notifiable diseases, right? Then we will give lot of support for that surveillance, and we have done lot of auditings, if we have found a patient from the one part of the country, then we will send all the details to on that area public health inspector via over the phone or mail. And we have a special form in Sri Lankan government issued 544 H544. We brought that and we will send it to the by mail, postal also. Then in postal, if we want to stop the postal delay, we always call to the MOH doctor and tell on that your area had a malaria patient. Then in MOH wise, they will decide to case study. Then all PHI went to that place and take the information, and they case will sort out.
That is when the mobile clinics also go.
Mobile clinic also. On that time, if in the rural areas, we will go to that places and take sample of blood for malaria testing, and we'll go and see there are sanitary problems like that. If they have collecting places of water, we want to removing that places. Other thing is, if we have any problem in any patient regarding that disease came from mosquitoes, we will go and fogging for all the places. That one is not done by nurses, that one is done by public health inspectors. They are the advisors for that. There is a supportive staff also, then they will go that place and fogging. Then we will take that collecting, then the entomologist also will go that places, and they take water sample in different places. They collect different samples, and they will check for who is the regarding mosquito and density. That one is very useful for eradicated that malaria. In the nursing part, there is in hospitals, we are always try to give lot of health talks, health interventions like that. We are doing lot of dramas in the public sector, hospital, in a school, like that places. Sometimes we have done lot of road shows in the visiting hour, who came to visit to see the patients in the hospital. Near that time, there are a lot of visitors are in the hospitals. On that time, we have done lot of street dramas and health talks for them to eradicate that malaria. We want we try to always do cut off the breeding places from your houses. The major thing, always we are try to tell the most probably place is you want to save your home. Then public areas we are covering in a lot of programs we have done. As a nurses, we have done lot of things in the hospital, in the school areas, school time, to students and the teachers. On that time, parents will come to that programs also. Then it is very satisfactory program. Then we have another community programs also, like that in a Kandy we have done near the market. There is a lot of lot of people come to the market. On that time we have done small dramas. Then they want to see that. Then we can give good health message for that people.
And the health message is given by the nurses themselves.
Nurses, the way we sometimes we always nurses are done that. As an actress, we can take the other minor staffs also. They will help us especially in infection control nurses. We have done lot of part for a surveillance system. Then we will go in the infection control nurse, go to all the wards to ward round, and they collected lot of information from the hospital BHTs and patients their visitors. Then we will take that information and came to our unit and sent to all the special places for who are regarding responsible places, especially malaria campaign and epidemiology.
So the health staff were very important in contributing to eliminating malaria.
Yeah. Yes. We have done that, no? Right. Okay.